Do you want to come stand on my other side, Jerry? Oh, okay, no worries. Hi, good morning.
Well, good morning. Let me thank the pool camera for being here. I'm especially grateful because this is an event that has been planned for action as it relates to Medicaid. We have decided that today, we the members of Congress, decided today would be a Medicaid Matters Day of Action. And as such, I'd like to give some brief information, and I have two persons who will give some additional information about Medicaid, and then we'll entertain your questions. Let me start by indicating that many persons are aware that at the joint session of Congress, I made a statement indicating that the president did not have a mandate to cut Medicaid. I said this because I understood the conditions that exist in my state and across the nation, indeed, as it relates to Medicaid, which is really health care for persons who cannot afford the health care that I have. I have been very blessed. I have some of the best health care that the world can provide. When we're in session, there's a physician available for us, and if something should happen, we are immediately taken to a physician, and we also have facilities that are available to assist us. Well, I want others to have what I have, but given that many do not, I want them to keep what they do have, and Medicaid is insurance that provides sometimes life-giving care, and life-saving care. Life-giving in that many of the persons who are born as children, they receive Medicaid treatments and care, and then in the twilight of life, persons receive Medicaid. So Medicaid is exceedingly important, and I'd like to give some indication as to just how important it is by sharing some statistical information. In the state of Texas, 36.2% of all children receive some form of Medicaid assistance. 48% of moms giving birth to their newborns receive some form of Medicaid assistance. 25.9% of working age adults with disabilities receive assistance. 61% of people living in nursing homes. 15% of Medicare beneficiaries. 8% of adults aged 19 to 64 receive some assistance from Medicaid. It's also important to note that individuals who need breast and cervical cancer treatments receive some form of Medicaid. We have children and pregnant women, parents and caregivers receiving Medicaid. So Medicaid is important to persons as it relates to not only their birth and some of the assistance that you need as you get older, but also for dental services, optometry services, hospice workers and services, physical therapy, and occupational therapy. Medicaid is important to people in various walks of life, not just because they are persons who happen to be in the state of Texas, but because they need the care that the government of the United States in concert with the state of Texas can provide. And I want to make sure that we continue to have this care. I have some colleagues who have indicated by way of a letter that they are going to avoid making cuts to Medicaid. And I'm proud that they're doing this because there was a mandate by way of legislation that we passed in Congress requiring that $880 billion be cut from the committee that has jurisdiction over Medicaid. $880 billion cannot be cut from that committee and not cut into Medicaid. It's impossible, absolutely impossible. And because of this impossibility, there's a good deal of consternation that still emanates from the notion that this cut may still take place. The parties on the other side of the aisle have indicated that they would like to cut $1.5 trillion so that they can have these monies to expend for a tax break. Well, I support having people have low taxes. But I don't support acquiring low taxes at the expense of the health of some people. I think all people merit good health care simply because if you're sick, we should accord it. And if you don't get it by way of some primary care physician, then you'll find yourself at a hospital. And at the hospital emergency room, this is the most expensive care that you will probably get. We don't want persons to have expensive care when you can have Medicaid that will give you not only care for the moment, but you get a course of treatment. You'll get the continuation of the care that makes a difference not only for the time that you are critically ill and in need of health care, but also as you recover from whatever your illness may be. Diabetes is the example that's quite often used. Persons sometimes will have an episode and need some immediate care, so they go to the emergency room. Well, the emergency room works to stabilize persons, and after they're stabilized, they don't get the continuation of care that would be necessary. There's a physician here who can speak to this much better than I, but the point is we want to make sure that we have this care for persons who need it, and I'm proud that some of my colleagues across the aisle have indicated that they will not allow themselves to support the cuts that may be necessary to achieve the $1.5 trillion, the $880 billion from the committee that has jurisdiction over Medicaid. So with this said, I would like to just simply say that the two ladies who are with me are outstanding public servants. They may not consider themselves as such, but I consider them great public servants. Ms. Catherine Rogers, who is the Vice President of Healthcare for the Homeless. She has had an opportunity to have a first-hand experience with persons who need health care. And this is important because not only do they need health care, but they receive it by way of Medicaid. So we'll have her say just a word. And then Dr. Victoria McCurry, the Chief Medical Officer of Healthcare for the Homeless, will also have a comment. And just before they speak, I want to let people know that I made my comments at the joint session of Congress, and I believe that what my colleagues across the aisle have said now, in a sense, is a form of vindication. But it does not mean that we should not be vigilant. I believe that people should be given an opportunity to do as they say they will do, but I also know that we have to be vigilant such that the words match the deeds. It's important for us to continue to monitor to make sure that Medicaid is available for those who really need it. And those who really need it are people who cannot afford to buy the health care that many people enjoy in this country. This is the richest country in the world. Notwithstanding all that we hear, we are still a world leader when it comes to persons having wealth and opportunities. And we want to make sure that health care is something that all persons in this country can have the benefit of enjoying simply because they're in the richest country in the world and we can afford it. With this said, I'm going to ask that Ms. Rogers, the VP of Healthcare for the Homeless, have a comment at this time, if you would.
Thank you so much, Congressman. Good morning. I serve as the Executive Vice President for Healthcare for the Homeless Houston, and I am joined today by Dr. Victoria McCurry, our Chief Medical Officer, who's a family physician with many years of experience working with underserved populations and specifically those who are experiencing homelessness and housing instability. HHH is the only federally qualified health center in Houston that specifically serves people who are homeless or housing unstable. And we operate on the front lines of healthcare, on the streets, in supportive housing communities, and in clinics. And every day we see the impact firsthand that Medicaid has in stabilizing lives. For our patients, Medicaid is not a bonus. It's oftentimes the only door to medical care. It's how someone gets treatment for heart disease before it leads to a crisis. It's how someone recovering from substance use can access ongoing behavioral health support. And it's how we connect patients to care teams and address their physical, mental, and social health together. So I want to ask Dr. McCurry just briefly to talk about her experience as a family physician and what she sees in our patients. I'm sorry.
Thank you. And thank you, Congressman Green, for this opportunity. I come to you on behalf of my patients. My name is Dr. Victoria McCurry. I'm a family medicine physician by training. I spent my career working with underserved populations, both locally, globally, and serve as the Chief Medical Officer for Healthcare for the Homeless Houston, as my colleague has shared. Our patients, to sort of channel their voice for a minute, are the patients with often some of the most urgent, complex needs that exist within our community here in Houston. They're deeply tied to their environment, as you can imagine. What Medicaid does for us now is allow us to intervene early, to start management in a way that provides that care over the continuum of their life, as opposed to in crisis, as Representative Green was sharing. This is from chronic conditions such as high blood pressure, diabetes, asthma, to other conditions that could be named, substance care being one of them. And truly, what we can do with Medicaid services is to provide consistent care, and I think that that's the theme. We care for patients who are infants all the way up to their passing years, to their geriatric years. So we care for the continuum of age at our clinics, and we see the impact of Medicaid, and especially for our patients who are experiencing housing instability, and what it's able to empower them to do with their lives, how they can become healthy, productive citizens in ways that they otherwise would have difficulty achieving fully if their healthcare conditions were not cared for sufficiently. Many of our patients have gone years without regular access to care, and often, as has been said, their only option as a result is the emergency room, where they receive care in the moment, but not care that helps to impact both them and their communities. And so what Medicare does is makes possible that continuity, builds trust with our patients, our community, and stability, and gives our patients a real chance to move forward. Thank you.
And I just want to add, this is not just about people who are experiencing homelessness. Across our country, more than 79 million people rely on Medicaid, including children, working parents, older adults, and people with disabilities. And 2/3 of Medicaid enrollees live in households where at least one person works. These folks are our neighbors. They are people who work hard, who care for their families, and they help build our communities. At our clinic and across thousands of other FQHCs across the United States, which serves more than 31 million people, Medicaid helps keep the lights on for us. It ensures that care is available in high-need areas, and it prevents emergencies from becoming tragedies. Cutting Medicaid would harm people who are struggling. It would strain emergency systems. It would make health crises become financial crises and make the path to stability even harder. Preserving and strengthening Medicaid is not just a matter of health care, it's a matter of public safety, economic stability, and human dignity. HHH and other health centers, we rely on our lawmakers to protect this lifeline for Houston and for every community across the country. We are so grateful for Congressman Al Green for his unwavering advocacy, and to the 10 House Republicans who have taken a stand against these harmful cuts. Your bipartisan leadership is essential in finding a budget solution that protects the health and well-being of all Americans. Thank you for your time today and the opportunity to speak on behalf of the communities that we serve.
Well, thank you, Ms. Rogers. And I'd like to just pick up on something that she said as it relates to my colleagues across the aisle. This should be a bipartisan effort. It really should not require us to be at odds with each other to provide health care to people who truly need the health care. So I'm making an appeal to my colleagues on both sides of the aisle. I think we should try as best as we can. Let's do the best that we can to engage in negotiation, not capitulation. If something is given to one side on a take it or leave it basis, that is not negotiation. That's at best capitulation. And we would prefer to, at the genesis of this process, have the opportunity to communicate and make reasonable and prudent decisions about the lives of people who need health care. Again, Medicaid is a form of Medicare, medical care more specifically. Medicaid is a form of medical care that is available to people who cannot afford the kind of care that a good many Americans have. I think that in the richest country in the world, we can do this for people who need health care. We always in this country allow people to come to our emergency rooms, but it's a much better means of treating when we allow them to have facilities like the FQHCs, the federally qualified health clinics, and other clinics to provide that care when they cannot afford the care of a primary physician in their lives, such as what I and many others have. So let's see if we can work together and come to an agreement as to how this can be done. But make no mistake about it, I will not support cuts to Medicaid that will cause persons to lose medical care. Medical care is absolutely something that we must protect, and to protect it, we will sometimes have to take extreme positions. My position is no cuts to the health care for people who need Medicaid. And I welcome questions.
Okay, so they say they're not going to support significant Medicaid cuts. Have they indicated, is that going to be enough? Are they indicating, like, are they still going to support some cuts? Have they indicated how much they would support, or they just?
Well, I'll pass a copy of the letter to you for your perusal, but as I read the letter, they indicate that they would allow for some streamlining. They use terms that are somewhat nebulous, and until we know what this actually means, I'm not sure that we can avoid being exceedingly vigilant. I'm going to be vigilant, and if my colleagues decide that they're not going to cut the services provided to patients and the medications provided, then we may be able to work something out. But if this is a way of saying we want the support of constituents and we make these comments, but when it's time to vote, that's what really counts. We will find out where people are when we vote on legislation, and we will then at that point know what's within the legislation and how it will impact people. People deserve health care in the richest country in the world. We have to provide it not only for the person that receives it, but because many times you prevent someone from having a transferable disease permeate a community by giving someone the care that they need to cure this disease before it gets to someone else. There are some diseases that are communicable. So I just think that it's a pretty easy thing for me to say, I will not support cuts to Medicaid that will deny services or treatments to persons who are in need of health care. Medicaid is a necessity in this country for people who cannot afford the health care that many others take for granted.
And any of y'all can answer this one on the local level. If there were to be significant cuts, what could the potential impact be to this Houston and the surrounding cities and its population?
Thank you for your question. So Houston has one of the largest medical centers in the country, and there are a number of community organizations that serve folks who are uninsured and underinsured, federally qualified health centers, and other medical organizations. And we really do rely on these funds to bolster what we do and make it possible. So community organizations would not have the resources necessary to provide accessible, comprehensive care that addresses the whole person's needs. It would cause more further reliance on our public health system, which is already overburdened as it is. And we would see a decline in the health and well-being of our community members.
Doctor, do you want to add anything to that?
Sure. I think, yes, to echo my colleagues' comments, specifically I think of our children who are Medicaid recipients. The wait times would go up for visits if they would become accessible at all. There would be increases, to be very specific, and true in an ability to attend school, to be able to get the care that they need so that they're not in the emergency room and rather at school. So these are some real impacts that I can see happening in our local community with changes, and they would be as a result of decreased ability to access important safety net clinics here locally. So that's the children, adults as well. So if you have an adult on Medicaid and suddenly they have most of their resources pulled, they would be unable to refill medications. Then you would see an increase in the number of emergency room visits seeking those medications, as well as an increase in the outcomes of the poor outcomes of their chronic conditions, because they'd be unable to take care of them as effectively as they normally would. So I see it actually have the potential to relate to a local increased public health risk around the city as a result. Thank you.
Thank you.
I'm going to add just this. The statistics do reveal quite a bit. And I indicated earlier, and I think it bears repeating that in the state of Texas, 36.2% of all children receive some Medicaid attention. 48% of moms giving birth and their children, their babies, receive Medicaid. This is a large number of children in our population, and pregnant moms, obviously. So if we don't have these funds going to them to help them, I don't know what that portends for mothers having babies, but it doesn't seem to me that it's going to be a good thing when you have 48% of the children in the state of Texas receiving some sort of Medicaid when they are being born. So we have to provide this service, but the federal government has stepped up. The federal government provides funds for Medicaid and has offered Texas even more funds for Medicaid. Texas was offered $100 billion to expand the Medicaid program, but the state of Texas declined $100 billion, and in so doing, put more people at risk. There is a waiting list. There are people who are trying to get Medicaid and are not getting it. We want to make sure that every person who needs health care can get it. That $100 billion would have helped a lot of people in our state, and it was declined because at some point Texas would have to pay 10% of the cost of the Medicaid expansion, and the federal government would pay 90% of the cost. Well, unfortunately for a good many people, the state of Texas declined the aid that was available. I'm not trying to condemn or demean. I'm just trying to make it clear that we have needs in this state that are being met, but we have some that are not. And because we have to protect those that are being met, we cannot allow cuts in Medicaid. We have to protect Medicaid. It helps not only the persons who receive the Medicaid, but also persons who are called dual eligibles who receive Medicare. They get some of their long-term care if they're in a hospital by way of Medicaid. So it really has a way of wrapping around people who are living in various stages of their lives. There are some people who get the Medicare and probably don't think that they are eligible or will be eligible to have the need for Medicaid, but they do in life. I happen to have an experience currently with someone who is in need of Medicaid and does not have Medicaid, does not have Medicare, and it is quite expensive when you don't have these services, when you don't have this type of medical aid provided. It is very expensive to get treatment when you need it and you don't have Medicaid or Medicare. So let's do what we can to protect it, and I welcome any additional questions. All right, well then, as a closing statement, I want to thank you for being here as a pool camera. I want to thank the stations that will carry some aspect of what we've said today. I hope that this message will have an opportunity to permeate our community, because the need is here, and there are people who are standing up to protect Medicaid, protect Social Security, protect Medicare. These are the safety net programs that our society has enjoyed for many years. We believe that they have served us well and will continue to serve us well, but they won't do it unless we take a stand to protect these programs. They are safety net programs, and we have people who have needs. In the richest country in the world, we can do this. I thank you.